Okay, good afternoon, everyone. So today I'm presenting this work on the gap between ideal and actual family size in Europe. And I will be looking at specifically at the role of infertility in influencing this gap. So many studies have examined the gap between the number of children individuals ideally would like to have and the number of children they're actually having. These studies have usually used a longitudinal approach, and they have compared fertility ideals measured at some point in a person's life to fertility outcomes sometime later. Some studies have used a short-term perspective and compared ideals with outcomes 3 to 4 years later, while other studies have covered a much longer time frame and compared ideals assessed in early adulthood to outcomes achieved by the end of the reproductive life. And regardless of when ideals are measured, a consistent result in all these studies is that underachieving preferred family size is much more common than overachieving that, and that many individuals fall short of their fertility ideals. However, it is less clear to what extent this reflects an unmet demand for children, or it is more simply due to the fact that people change their preferences over time. So we know that fertility preferences are not static, but they change with age. And when we ask people in early adulthood what are their fertility preferences, they're more likely to express idealized views and not real plans. However, as they move through life and experience milestones, such as finding a job or moving in with a partner, they usually adjust these preferences, often downwards, and they develop their actual preferences, which are more reflective of their plans. And so the earlier we measure fertility ideals, the larger will be the gap that we're going to estimate. And it is possible that in some of the studies that I mentioned before, the gap has been overestimated. Another approach would be to measure fertility ideals at the end of a person's reproductive life. And this would involve a personal reflection on a person's entire reproductive journey. And in this way, we would measure a specific type of underachieved fertility, which is that one of a person ending the reproductive life with less children than what they would have hoped for. This end-of-life perspective is pretty rare in the literature, and we could only find 2 studies that have used it. Both of them are in developing countries. So in our study, it would be the first application to the European context. We were also interested in understanding why so many people are falling short of their fertility ideals, and we especially focused on the effect of postponement, which has a negative impact on the ability of achieving an ideal family size, mostly for 2 mechanisms. So first, due to the existence of social age limits for childbearing, which refers to the idea that in societies there is an age after which having children is considered too late, and also biological constraints, that is the age-related increase in medical infertility. However, usually infertility is not analyzed by itself, but it is included in a more general age effect. However, we want to focus specifically on infertility because this is a clear barrier to the achievement of a desired family size, and because of childbearing delay, it has likely increased its importance in explaining the gap. So our objectives are to describe the discrepancy between fertility ideals and outcomes, with ideals measured at the end of the reproductive life, and also to explore which factors influence the discrepancy, with a particular focus on infertility. The analysis is done for both men and women and across 8 European countries. The data come from the second round of the GGS. For ideal family size, we use a question asking respondents, for you personally, what would be the ideal number of children you would like to have or would have liked to have? And this is compared with the number of children they actually end up having. And then for lifetime infertility, we use a question asking respondents whether there was ever a time when you and your partner were trying to get pregnant but didn't conceive for at least 12 months. And this corresponds to the medical definition of infertility. And the analysis is restricted to people aged 42 to 50. So for most women will be at the end of the reproductive career by this age, but we recognize that for men this may not be the case, and so for men the gap may be overestimated to some extent. And then we use some other information for our multivariate models, information on union trajectories, so whether the person, the respondent was experienced co-residential unions, separation or divorce, age of first union formation, whether the respondent was childless at age 30, which is a measure of fertility postponement, and education. So you can see here in this figure the mean ideal and achieved family size by age 42-50 in the countries under analysis. So first of all, it is interesting to see that there is a clear gap in all countries, even when we use our measure of fertility ideals, which is collected at the end of a person's reproductive life. This gap is not only visible at the aggregate level, but also when we look at the individual level, we can see that there is a substantial proportion of respondents who have an ideal family size at the end of their reproductive life, which is larger than the number of children they had. In this figure, I'm not showing the proportion of respondents with an ideal that is below the number of children they had, because these proportions are very small. For women, it is between 2 and 4%, and for men 2 and 6%. So most people either achieved their ideal family size or fell short of the ideal family size. And for example, we could look at one country like Austria, where we can see that about half of the respondents achieved their ideal family size, while the other half fell short of that. We then looked at these results by parity. So these are respondents who are childless by age 42 to 50. So we can see that childlessness is most often an unwanted outcome. However, there are some interesting geographical differences. For example, if we look at women in the Nordic countries, we see about 25% of those who are childless by age 40 to 50 also say that their ideal family size is 0, while in the other countries this proportion is much smaller. If we look at parity 2 respondents, here the proportion of those with achieved ideals is much higher, and this is in line with the fact that in most European countries there is a preference for a two-child family, but it is still interesting to see that a substantial proportion of people would have liked to have, ideally liked to have more children than what they had. Then we looked at the factors influencing the gap. We were especially interested in infertility. Here you can see the proportion of respondents with underachieved ideals by their infertility status. And for women especially, it's very clear that if women have experienced infertility at some point in their life, they are much more likely to have underachieved their fertility ideals compared to women that have never experienced infertility. And the association is a bit less clear for men, but even there it seems to be a link. Here I'm showing results only for Austrian women. This is the binary logistic regression predicting underachievement versus achieving or exceeding an ideal family size. In the first model, I have included variables capturing the timing of events, age of first union, and whether the respondent was a parent by age 30, which is a measure of fertility postponement. We see that these postponement variables are very significant in predicting underachievement. In model 2, we added infertility, and infertility is a very strong predictor, but it is interesting that the other variables remain significant, and so this points to the social and biological components of postponement and to the fact that they are both relevant in explaining underachievement. So summing up, we found a clear gap between ideal and actual fertility in all the countries that we analyzed, and for both men and women. This is consistent with the results from previous studies. that compared early preferences to actual fertility. But in our study, we use the measure of fertility ideas collected at the end of a person's reproductive life. And so this may provide stronger support to the fact that it is not simply a change in preferences over time that is explaining the gap, but it is actually the existence of constraints or barriers, especially when we look at the effect of infertility, which is clearly a barrier. There are also some shortcomings of using this type of measures. It could be that people are reluctant to say that they want a number of children that they didn't end up having. And there could also be a justification bias for children already born, who are often considered intended even if they were not. We also found that postponement is a key determinant of this gap, and both its biological and social components. Thank you.